In this video, I am going to discuss the musculoskeletal care modalities. And for the overview, musculoskeletal problems are widely experienced and place a significant burden on people, the community, and the health system. Especially yung mga taong involved in vehicular accidents like motorcycle accident. Kita natin, di ba, sa video na napanood natin last time, in an orthopedic hospital, we can see how hard it is sa mga pasyenteng nagkaroon ng musculoskeletal impairment. They are really in pain and yung difficulties na pinagdadaanan nila is talagang napakahirap. So their management frequently includes the use of plaster cast, braces, splints, traction, artificial joint replacement, and or surgery. So, ito yung mga ginagamit natin to help our patient na may problems with musculoskeletal. Okay, and then the nursing care is planned to maximize the effectiveness of these treatment modalities and to prevent potential complications. So, as a nurse, our role is to ensure na yung mga modalities na nabanggit ko nito are effective in treating their problems. And then our role is very important to monitor to prevent potential complications sa pasyente at definitely sa paggamit din kasi ng mga modalities na to, hindi may iwasang magkaroon ng problems such as, for example, sa paggamit ng cast, pwedeng in relation to the patient's condition, pwede siyang magkaroon din ng compartment syndrome. So that is a complication of a patient na nakakast. So therefore, as a nurse, dapat we monitor our patient na nagkaroon or undergoing this kind of modalities. So first, we are going to discuss the patient in a cast, brace, or splint. So we will first focus sa cast muna tayo. So when we say cast, it is a rigid external immobilizing device that is molded to the contours of the body. So nilalagay natin yan sa specific part of the body na nagkaroon ng problem such as fracture so that ma-immobilize yung area or yung part na yon. So, ang purpose ng cast is to immobilize a body part in a specific position and to apply uniform pressure on an encased soft tissue. So, naglalagay tayo ng device. It is an external device para yun na nga, makorek yung problem na meron yung patient. Specific use to immobilize a reduced fracture. So, aayusin mo na yung fracture. Like, for example, i-reduce mo na siya and then after ma-reduce or maayos or for example, ma-straighten yung bone, pwede nang lagyan ng cast. Another specific use is to correct a deformity, to apply uniform pressure to underlying soft tissue or to support and stabilize weakened joints. So these are the specific uses. While for the general use, si cast, it permits mobilization of the patient while restricting the movement of a body part. Ito yung kagandahan sa cast because we only immobilize the specific body part involved while the patient can move. Okay, nakakagalaw si patient freely. Ang naka-immobilize lang yung specific body part na may problema. So, casting is the mainstay of treatment for most fractures. So, ito yung common na treatment natin sa mga patient na nagkaroon ng fracture. So, the most common casting materials consist of fiberglass or plaster. Mamaya, we will get to know what is fiberglass cast and what is a plaster cast. So the condition being treated influence the type and thickness of the cast applied with the joints proximal and distal to the area to immobilize included in the cast. Okay, so we are going to discuss the different types of cast. So first, you have the short arm cast. So short arm cast, in our example, ito siya. If you would see, short arm cast is really different from long arm cast in terms of the length and in terms of um, yung kung saan siyang part na ilalagay sa ating arm. Okay? So, short arm cast, it extends from the elbow. So, from the elbow to the palmar crease here, secured around the base of the thumb or inclusive of the thumb. So, pwedeng kasama yung inclusive yung thumb or around the base of the thumb lang. Okay, so again, si short arm cast from the elbow, from below the elbow to the palmar crease. Ito. Again, from below the elbow here to the palmar crease. So this is where we place our short arm cast. Now, for the long arm cast, ito naman yung ating figure. So it extends from the upper level here, level of the axillary fold to the proximal palmar crease. So mas na-extend lang yung long arm cast doon sa ating upper level of the axillary fold. Okay, so mas naging lengthy lang yung long arm cast in comparison to short arm cast. So usually the elbow is immobilized at a right angle. So naka-right angle yung arm na ating i-immobilize. Now, we go next to the short leg cast. So here's the short leg cast. So it extends from below the knee here. So below the knee to the base of the toes. So this is the short leg cast. So the foot is flexed at a right angle in a neutral position. So naka-right angle siya, neutral position. Next, for the long leg cast, ito naman siya, it extends from the junction of the upper and middle third of the thigh to the base of the toes. So pag long leg cast, so definitely, mas nag-extend lang yung kanyang coverage in comparison to short leg cast. So the knee may be slightly flexed. So in this case, the knee may be slightly flexed. So these are the different types of cast involving the arm and the leg. Next, we have here the walking cast. So a walking cast is a short or long leg cast reinforced for strength. Wala lang tayong example here. And then next we have a body cast. So it encircles the trunk. So body cast, it encircles the trunk here. This one is a body jacket cast. So pagka body cast, naka-envelope siya sa ating trunk. Pag shoulder and spica cast, here, this one is a shoulder spica cast. So a body jacket that encloses the trunk, the shoulder, and the elbow. So naka-enclose ito, the trunk, the shoulder, and the elbow. That is the shoulder spica cast. So this one. So parang covered talaga siya and up until dito sa ating arm. Shoulder spica cast. Next, hip spica cast. So ito naman, si hip spica cast, either you have a single hip spica, ito naman yung double hip spica. Hip spica cast encloses the trunk and a lower extremity. So enclose again for the hip spica cast. So from the trunk and then sa lower extremity naka-enclose siya. So double kapag both legs yung kasama and then single kung one lang. Okay, so yung difference ng shoulder with hip, ng shoulder, ang naka-envelope lang is yung ating trunk. Tapos kasama si shoulder and elbow. And then for hip spica cast, naka-enclose na si trunk including the lower extremity. Either single yan or double. So, ito pa yung different types of cast. So, depende kung saan nga siya ilalagay na body part. Okay, so let's now proceed to the different types of cast. So commonly we have two types. So you have the fiberglass and the plaster cast. For fiberglass cast, so it is composed of polyurethane resins that have the versatility of plaster, but are lighter in weight, stronger, water resistant, and more durable than plaster. So ito yung tsura niya. So, yun yung advantages ng paggamit ng fiberglass. Okay? So, lighter siya, stronger, tapos water resistant, and durable than yung plaster, yung other type of cast. So, it has the benefit of reaching full rigidity within 30 minutes of application. So, titigas na yung ating fiberglass cast, okay, within 30 minutes of application. And then, so mabilis yun in comparison to plaster cast. So they consist of an open weave, non-absorbent fabric impregnated with cool water activated hardeners that bonds and reach full rigid strength in minutes. So tumitigas yung itong mga cast, I mean yung mga, yun nga, this one, si fiberglass and of course si plaster cast upon application. Okay, kapag ka-in-apply na natin siya doon sa affected part of the body. Now, heat is given off called exothermic reaction while the cast is applied. So therefore, a newly applied fiberglass cast should not be placed on a plastic surface. So kapag in-apply na siya, somehow nag-give off siya ng heat called exothermic reaction. Kaya we should, yun na nga, not place this body part na kinas natin sa plastic. So you definitely know the reason why. So the heat given off during this reaction can be uncomfortable and the nurse should prepare the patient for the sensation of increasing warmth so that the patient does not become alarmed. So definitely, health teaching or health education sa ating pasyente na may experience niya yung heat na to and it is he or she should not worry naman because that is tolerable. Although uncomfortable pero tolerable siya. And ano lang naman siya for a very short duration lang yung exothermic reaction na to while the cast is hardening. So while the cast is setting, it can be dented. So be careful kasi habang um, tumitigas pa lang yung cast, pwede siyang ma-dent or pwede siyang magkaroon ng irregular shape or baka yun na nga magkaroon ng malformation during the setting of the cast. So the heat given off from this cast does not place the patient's skin at risk for thermal injury like plaster cast. So wala namang mangyayari habang tumitigas yung cast because of that heat. So ito, it must be handled with the palms of the hands and not allowed to rest on hard surfaces or sharp edges. So habang nagkakaroon ng exothermic reaction. Okay. So fiberglass gas application, I included here the link. Kung this link shows how to apply a fiberglass cast. Okay, so I included here the video and the link. So I will send this PowerPoint to you so that you can access this link after. So after that, the first type is fiberglass cast. The second one is plaster cast. So casts made of plaster are less costly and achieve a better mold to the affected body part than fiberglass cast. So mas mura tong plaster cast. So mas affordable. And then mas maganda yung mold to the affected body part in comparison to the fiberglass. However, they are not as durable and take longer to dry after application. So that is a disadvantage of plaster. So, hindi siya gano'n ka-durable kagaya ng fiber at saka mas matagal siyang matuyo after the application. Now, rolls of plaster bandage are wet in cool water and applied smoothly to the affected body part. A crystallizing reaction occurs and heat is given off, an exothermic reaction. So, yun na nga, upon application din ng plaster cast, nag-give off din siya ng exothermic reaction or ng heat, kumbaga. Okay, so the nurse again should explain that the cast needs to be exposed to air to allow maximum dissipation of the heat and that most casts cool after about 15 minutes. So, let the air flow lang, tapos papatuyuin lang siya para ma matanggal yung heat. Okay, so kailangan may good ventilation definitely. And then after naman few minutes such as 15 minutes, um, tapos na yung exothermic reaction ah, sa paggamit or upon application of the cast. Okay, so the crystallization process produces a rigid dressing. So sa pag-hardening ng cast, sa crystallization na yon, ayun, nagiging ano siya, nagiging matigas siya, nagiging rigid siya. So the speed of the reaction varies from a few minutes to 20 minutes nga. So after the plaster sets, the cast remains wet and somewhat soft and does not have its full strength until it is dry. So talagang we should let the plaster cast dry first before na talagang um ma, ma ano ma maging functional siya. So while damp, so the plaster cast can also be dented. So habang hindi pa masyadong matigas yung plaster cast, ganun din, kagaya ng fiberglass. So, pwede rin siya magkaroon ng dents. So, we have to be careful. So, the plaster cast requires 24 to 72 hours to dry completely. So, ganun katagal yung plaster cast. Okay? 'Di ba yung um, si ating fiberglass, if you would remember, ilang minutes lang siya. It is 30 minutes after, within 30 minutes after application, rigid na agad siya. Okay, pero si plaster cast, it will take 24 to 72 hours to dry completely pa. Okay, completely. Depending pa rin on the thickness and the environmental drying conditions. Pero that is the average. Now, when moving a patient with a wet plaster cast, only the palms of the hand should be used so that indentations in the cast may be prevented. So, yun, ang technique ano, sa palms of the hands lang ng pasyente tayo humahawak para ma-prevent yung any dents na mailagay doon sa cast, sa plaster cast while it is hardening. So indentations can result kasi in areas of pressure on the skin. Baka magkaroon ng pressure ulcer si patient. So a freshly applied cast should be exposed to circulating air to dry and should not be covered with clothing or bed linen. So air dry, kumbaga, yung ating plaster cast. And then a wet plaster cast appears dull and gray, sounds dull on percussion, feels damp, and smells musty. So a dry plaster cast is white and shiny, resonant, odorless, and firm. So you can try this one kapag naka-handle kayo ng patient na may cast. So you can, um, ayun, you can, for example, inspect that cast and then pwede nyo siyang i-percuss, okay? And then, tingnan nyo if this is the case, okay? So, that is a dry plaster cast na, meaning natuyo na yung cast. Okay, so, I have here naman a video on the application of a plaster cast. Actually, pareho lang naman yung application ng fiberglass cast at saka ng plaster cast. So, same lang yung concepts. Kaya lang, may differences lang like in terms of the materials, and then yung tagal nga ng kanyang pagtuyo when it comes to plaster cast. So please watch this video na link na meron ako. So this one is the application of plaster cast sa wrist, and the other one is sa lower leg. And then I just included here the guidelines for applying a cast. So this is how you apply cast sa ating patient na may problem with their musculoskeletal. So ayan, I just placed here another example or a video on cast application, this time double shoulder. Kung paano mag-cast ng parehong shoulder if that is the problem of the patient. And then double hip spica. I have here a video, just an overview lang para makita nyo rin how to apply a double hip spica cast. Okay, so one of our performance tasks, di ba? Sige, mamaya after I discuss the braces and splint. So after cast, I will discuss splints and braces. Now, many injuries that were previously treated with cast may now be treated with other immobilization devices. Kasi yun na nga, the common treatment, di ba, na binibigay sa mga may fracture is cast. Pero nowadays, it's not always the cast yung option because splints and braces can also be used. Contoured splints of plaster or pliable thermoplastic material may be used for conditions that do not require rigid immobilization, for those in which swelling may be anticipated, and for those that require special care. So ito yung mga time or conditions kung kailan tayo pwedeng gumamit ng splints and braces. Okay? Kung yung affected body part naman do not require rigid immobilization, tapos kung magsuswell, there is an anticipation na baka mag-swell yung body part, at saka if it requires a special care, so we can use splints and braces na lang instead of cast. Now, splints made of thermoplastics are warm and molded to fit the patient. So just like this. And then the splint needs to immobilize and support the body parts in a functional position, and it must be well padded to prevent pressure, skin abrasion, and skin breakdown. So same principle with applying a cast. So we do not want to develop or to develop complication nga in applying these modalities. Now the splint is overwrapped with an elastic bandage applied in a spiral fashion and with pressure uniformly distributed so that circulation is not restricted. So yung splints are generally indicated for short-term use lang. Ibig sabihin the problem is not so severe in comparison sa paggamit ng cast. So this is an example. So meron tayong different different types or different looks of a splint. So it depends then on the materials. Ayan. So this is how you apply an orthopedic splint or splint to our patient. So take note because our performance task is in relation to this. Okay, so here I have included here a video naman on how to apply a splint. Arm splinting to for 8 minutes yung video. Okay, so braces naman. So that is splint. Now we proceed with braces. So splint is different from a brace. So braces, examples are orthoses. It used to provide support, control movement, and prevent additional injury sa body part na affected. So they are custom fitted to various parts of the body and therefore tend to be indicated for longer term use than splint. So mas mahaba yung paggamit ng braces at saka individualize yung pag-fit natin sa mga brace na ginagawa. So the orthotist adjusts the brace for fit, positioning, and motion so that movement is enhanced, any deformities are corrected, and discomfort is minimized. So most common, ginagamit siya for rehabilitation ng mga nagkaroon ng injury. Okay, itong mga braces na 'to. So before the now, so yun yung ano 'no, so ganun lang kaikli yung sa brace. So here are the examples of braces, okay? Now, iyan yung modalities na una natin i-discuss. You have the cast, you have the splints and braces. Now, our next focus is the nursing management of a patient in a cast, splint, or brace. So ano yung mga dapat nating gawin as a nurse sa mga sa mga pasyente natin nagkaroon ng ganitong modalities. So here, before the cast is applied, the nurse completes an assessment of the patient. So again, definitely included in our nursing process, assessment. So we always have to assess our patient first. So tingnan muna natin yung ating pasyente before applying any modality. General health, presenting signs and symptoms, emotional status, among others. And then physical assessment naman of the part to be immobilized must include the assessment of the neurovascular status. That includes neurological and circulatory functioning of the body part, tapos degree and location of swelling, bruising, wounds, and skin abrasions. So we have to perform a thorough PE or physical exam sa problem or sa involved musculoskeletal. Okay, next. How do we now relieve pain sa mga pasyenteng naka-cast, splint, or brace? So first, you have to evaluate pain associated with musculoskeletal problems. You ask the exact site and describe the character and intensity of the pain. Most pain naman can be relieved by elevating the involved part, so applying cold as ordered and administering prescribed doses of analgesics. So yun muna yung mga gagawin natin, ano? Independent nursing intervention. So you elevate the involved body part, apply cold as ordered by the doctor. And then afterwards, if hindi pa rin, then you can now give medication as prescribed by the patient, by the doctor. So that is a dependent nursing action. Now, alert, a patient's unrelieved pain must be immediately reported to the doctor to avoid possible paralysis and necrosis. Later on, mas malalaman natin what I am referring to kapag ka may pain yung pasyente na nakakas or naka-splints and braces. Again, you have to report to the physician if may na-experience si pasyenteng ganito. Okay, pain, unrelieved pain. Okay? Because that might be a complication. So pain associated with the disease process, for example, fracture, is frequently controlled by immobilization. While pain naman due to edema that is associated with trauma, surgery, or bleeding into the tissues can frequently be controlled by elevation. And then if prescribed, intermittent application of ice packs, kagaya nung diniscuss natin kanina. Now, pain naman associated with compartment syndrome is relentless and is not controlled by the interventions above. So, okay lang sana kung itong mga pain yung definitely we do not want pain. Pero kapag ka compartment syndrome, parang this is really a serious problem in comparison to pain associated with the disease process and pain due to edema. Okay, so with compartment syndrome, it is relentless, tapos hindi siya nawawala by doing the interventions na sinabi dito. So severe pain over bony prominence warns of an impending pressure ulcer. So we also take note of any of the pressure ulcer developing to our patient doon sa kanyang cast or splint or brace na body part. Pain decreases naman when ulceration occurs. So, discomfort due to pressure on the skin may be relieved by elevation that controls edema or by positioning that alters pressure. So, these are the different types of pain na pwedeng associated sa na you have an association with the different problems. Okay? So, please take note of this para alam mo na, for example, kung nare-relieve naman yung pain, so probably hindi yan compartment syndrome. Kung nare-relieve siya, for example, ng elevating lang or using ice pack, so probably baka due to edema lang yan or due to the disease process lang yan. Okay, pero if otherwise, kung unrelieved, then you have to be wary na. You have to be attentive na because the patient may be developing compartment syndrome. Okay, so tapos yun na nga, no, pag pressure ulcer, we have to take note of this pa rin. Pagka developing pa lang siya, there is severe pain. Pero kapag ulceration occurs na, so yung pain decreases. So you have to be alert. You never ignore complaints of pain from the patient in a cast because of the possibility of potential problems such as impaired tissue perfusion or pressure ulcer formation. So hindi natin ini-ignore kapag sinabi ng pasyente na may pain siyang nararamdaman because that might lead to a complication. Okay? So impaired tissue perfusion or pressure ulcer formation that may lead to compartment syndrome. Okay. Next we have improving mobility. So how do we improve mobility sa ating pasyenteng naka-cast, splint, or brace? So every joint that is not immobilized should be exercised and move through its ROM to maintain function. So kung for example, ito lang yung naka-immobilize or naka-cast, so definitely si patient can move his or her fingers, right? So dapat we instruct the patient to perform ROM doon sa mga parts na hindi naman affected sa mga parts na hindi naman nakakast. For example, if the patient has a leg cast, we encourage toe exercises. While if the patient has an arm cast, encourage finger exercises. Mahalaga na we still promote mobility sa mga unaffected body part. Now, promoting healing of skin abrasion. So before the cast, brace, or splint is applied, you have to treat skin lacerations and abrasions to promote healing. Hindi naman basta-basta na lang magka-cast. So definitely, kung may skin problem yan or may laceration or abrasion yan, yun muna yung ititreat before we apply cast. So while the cast is on, the nurse observes the patient for systemic signs of infection, odors from the cast, and purulent drainage staining the cast. So it is important to notify the doctor if any of these occurs. So probably baka that is an infection na. So we have to be reminded of this. How to next, maintaining adequate neurovascular function. So swelling and edema are natural responses of the tissue to trauma and surgery. So we monitor circulation, movement, and sensation of the affected extremity. We assess the fingers or toes of the casted extremity and comparing them with those of the opposite extremity. So this is how we monitor for the neurovascular function of the affected part. Normal findings include minimal swelling, minimal discomfort, color consistent with the patient's coloring, warm to touch, rapid capillary response, normal sensations, and ability to exercise fingers or toes. So, ibig sabihin, okay pa yung casted or naka-splint na body part. So, the nurse encourages the patient to move fingers or toes hourly when awake to stimulate circulation. So, again, napakahalagang function ng nurse is to monitor for the neurovascular function of the patient sa mga naka-cast, naka-brace, or naka-splint. Now, maintain adequate neurovascular function. So, just the same continuation to, assessment data that include progressive unrelieved pain, pain on passive stretch, paresthesia, motor or sensory loss, coolness, paleness, slow capillary refill, and sensation of tightness indicate potential compartment syndrome. So, kung yung kaninang nabanggit are normal findings, ito naman, yung mga findings na to are indicative of potential compartment syndrome. So, kailangan maging ano ka na dito, maging alert ka na when you notice these types of, or I mean, these symptoms or these signs na ipinapakita ni pasyente. So the nurse adjusts the position of the extremity so that it is no higher than heart level to enhance arterial perfusion and control edema, and notifies the doctor immediately. So dapat, again, no higher than heart level para ma-enhance yung arterial perfusion doon sa sa may problemang body part. Okay? So not higher than the heart level. So monitoring and managing potential complications. So potential complications related to cast, braces, and splints include compartment syndrome, pressure ulcer formation, and disused syndrome. So commonly occur when a cast is applied because the cast is rigid and encompasses the affected limb and is not easily removable. Kasi nga, parang enclosed external device yung cast na yan that is rigid. So definitely, pwedeng magkaroon talaga ng complications such as itong mga nabanggit. Compartment syndrome, pressure ulcer, and disused syndrome. So let us first discuss compartment syndrome as one of the complications. So pag sinabing compartment syndrome, vascular insufficiency and nerve compression due to unrelieved swelling can result in this problem, compartment syndrome. So again, vascular insufficiency at saka nako-compress yung nerve. Pag sinabing vascular insufficiency, hindi maganda yung circulation or flow of blood doon sa affected body part. So compartment syndrome occurs when there is increased tissue pressure within a limited space. So nag-i-increase yung pressure kasi nga tapos limited pa yung space. For example, nakakast siya tapos meron pang tayong mga muscle compartments that compromises the circulation and the function of the tissue within the confined area. So here for you to visualize that. So ito yung mga muscle compartments natin. Okay, this is a normal lower leg. Okay, normal lower leg. Ito yung mga muscle compartments natin. You have anterior compartment, lateral, superficial, deep. So ayan. And then ito yung mga associated na other body parts like tibial bone. Ito yung mga nerves and blood vessels. Ayan, fibular bone. So ito yung normal. Kita ninyo na okay pa yung ating nerves and blood vessels. However, sa pasyenteng may compartment syndrome, ayan, na-compress yung mga nerves na yan and blood vessel and this one. So from here, kita nyo yung normal, talagang very compressed. Tapos, compressed din definitely yung mga muscle. It is compressing or parang pressing yung mga structure na yan, including the nerves and the blood vessels. So, hindi siya parang makahinga or kasi it's a compartment. Meaning, enclosed siya, enclosed area tong ano natin, this one. Okay? So, tapos idagdagan pa ng cast or ng splint. So, yeah, this is a compartment syndrome. Okay, so to relieve the pressure, the cast must be bivalve. So, binabivalve natin yung cast to relieve yung pressure. Kasi nga, di ba, kailangan nating parang makahinga yung affected body part. Kasi parang pumuputok siya, something like that. So we need to bivalve or cut in half longitudinally the cast. So while maintaining alignment, and the extremity must be elevated no higher than heart level pa rin to facilitate vasculature return while ensuring arterial perfusion. So that's the reason why yun yung level um, ng affected body part. So no higher than the heart. Now, if pressure is not relieved and circulation is not restored, for example, na bivalve na yung cast tapos hindi pa rin na-relieve yung pressure and hindi pa rin maganda yung circulation, we perform fasciotomy. So fasciotomy, the tissue that surrounds the area is cut open to relieve pressure. So yung pinaka-tissue na mismo. So for example, binivalve na natin, in bivalving yung cast, yung ino-open up natin para magkaroon ng room yung affected body part. However, kung hindi pa rin siya na-relieve, fasciotomy na yung gagawin kung saan yung pinaka-tissue na mismo yung i-cut open para ma-relieve yung pressure. So, it may be necessary to relieve the pressure nga within the muscle compartment. So, something like this, medyo maliit lang yung picture, pero yan. So, we really cut open the tissue. So, the nurse records neurovascular responses and promptly reports changes to the doctor. So, that is the first complication. You have the compartment syndrome. Next, we have pressure ulcers. So pressure of the cast on soft tissue may cause tissue anoxia and pressure ulcer. So in this picture, pinapakita lang yung mga common points or common areas kung saan pwede magkaroon ng pressure ulcer because itong mga area na to are bony prominences, meaning yan yung mga bones talaga na protruding sa atin. So definitely, pwede magkaroon ng pressure ulcer sa mga parts na to. So the for pressure ulcer, the patient reports pain and tightness in the area. A warm area on the cast suggests underlying tissue erythema. So nagkakaroon na ng inflammation. So the area may break down and drainage may stain the cast and emit an odor. So the nurse must monitor the patient with a cast for pressure ulcer development and report findings to the doctor. So you have to inform the physician. So they inspect the pressure area. The brace may be removed. So for a patient with a cast, a doctor may bivalve the cast or cut an opening or window in the cast. So, di ba sa kanina sa compartment syndrome, binabivalve natin yung cast. Hindi naman tinatanggal, bivalving, wherein we cut open longitudinally the cast. Ganun din sa pressure ulcer, para makita natin yung body part na affected, pwede natin i-bivalve yung cast para to permit para makita natin yung pinaka affected part. So, ayan. Doon sa here, mamaya meron akong video. Okay, ito pala siya. So, procedure for bivalving a cast. So, ito, I just included here yung procedure on how to bivalve a cast. Okay? This is the step-by-step procedure. And then I included here a video where you can watch kung paano mag-bivalve ng cast. So please, please watch it and then take note of these steps sa pag-bivalve ng cast. Okay, next, so after compartment syndrome, after this pressure ulcer development, another complication is disused syndrome. So immobilization in a cast, brace, or splint can cause muscle atrophy and lost strength known as disused syndrome. So to prevent this, the patient needs to learn to tense or contract muscle. So again, ang panlaban natin to prevent disused syndrome is that the patient needs to learn kung paano mag-tense or to contract the muscle. And ito yung tinatawag, for example, isometric muscle contraction without moving the body part. Siyempre nga, di ba, ang goal natin is to immobilize the body part. So definitely, yung unaffected body part, pwede natin siyang pag-exercisein yung pasyente using isometric muscle contraction. So this helps to reduce muscle atrophy and maintain muscle strength. So the nurse instructs the patient with a leg cast, for example, to push down the knee and instructs the patient in an arm cast naman or brace or splint to make a fist. So ito yung sa leg cast, pag naka-leg cast siya, pa-push down the knee natin yung pasyente. Sa mga naka-arm cast naman, we ask them to make a fist. Now, muscle setting exercises, kagaya nitong quadriceps setting and gluteal setting exercises are important in maintaining muscles essential for walking. Okay, kung ang cast niya ay nasa leg. So, we can instruct how to perform muscle setting exercises. Isometric exercises should be performed hourly while the patient is awake. Siyempre, si patient yung gagawa niyan, definitely dapat he is awake. Now, I just included here how to perform muscle setting exercises. Isometric contractions of the muscle maintain muscle mass and strength and prevent atrophy. And examples of this include yung quadriceps setting exercise and gluteal setting exercise. So, nilagay ko yung instructions on how to perform this one. And then I have included here the video for you to see kung paano ginagawa yun. So, kindly access the link for you to see. Okay, so next, here, I included a video on how to remove a cast. So, please access this. This one showing leg cast removal. And in this one, how to remove a cast sa pediatric patient. Now, what are the nursing management of the, ano yung nursing management natin sa pasyenteng with an immobilized upper extremity? So, ano yung ating mga dapat malaman? So, a sling, just like this one, or a collar and cuff may be used when the patient ambulates to prevent pressure on the cervical and spinal nerves. The sling should distribute the supported weight over a large area and not solely on the back of the neck. Siyempre, baka mangalay yung part na yan. So, dapat equally distributed yung weight, yung weight ng affected body part. So, the nurse encourages the patient to remove the arm from the sling and elevate it frequently. So, kung maglalakad-lakad lang siya or kung gagalaw, ayun, pwede natin siyang lagyan ng sling. Common, ginagamit yan sa atin. Now, what is a contracture? So, contracture of the fingers and wrist occurs as the result of obstructed arterial blood flow to the forearm and hand. So, the patient is unable to extend the fingers, describes abnormal sensations such as unrelenting pain, pain on passive stretch, and exhibits signs of diminished circulation to the hand. So, parang feeling niya naninigas yung kanyang fingers and yung wrist kasi nga impede yung blood flow doon. So, contracture. So, just like this one. Okay, so sakit siyan and especially sa mga elder natin. So, permanent damage develops within a few hours if action is not taken. So, this serious complication can be prevented with frequent neurovascular checks. So, dapat na monitor natin kung merong problema, kung may ganitong problem sila patient so that we can address the problem immediately. So, ito naman, nursing management of the patient with immobilized lower extremity. Sa baba naman, ano yung mga dapat natin gawin sa mga pasyenteng may modality or immobilized sa kanilang lower extremity. So the nurse assess circulation by observing the color, temperature, and capillary refill of the exposed toes. So ganun pa rin, neurovascular check pa rin. So nerve function is assessed by observing the patient's ability to move the toes and by asking about sensation in the foot. So numbness, tingling, and burning may be caused by peroneal nerve injury from pressure at the head of the fibula. Now you have to be alerted. So injury to the peroneal nerve as a result of pressure is a cause of foot drop. Okay, so again, peroneal nerve, injury sa peroneal nerve as a result of pressure is a cause of foot drop. Pag sinabing foot drop is the inability to maintain the foot in a normal flex position. So nakadrop yung foot natin. Okay, so that is because nagkaroon nga ng damage peroneal nerve. Okay, because of the pressure, because of a pressure which is caused by which is a cause of foot drop. So consequently, the patient drags the foot when ambulating. So ibig sabihin, nagkaroon ng foot drop si pasyente because nagkaroon ng um, pressure sa kanyang peroneal nerve. Okay, nagkaroon ng problema yung kanyang peroneal nerve, kaya foot drop happen. Okay, so consequently, ayun, the patient's drugs the foot when ambulating. So yun yung ganun siya kapag ka nag-ambulate. So parang minahatak niya lang yung kanyang foot, yung kanyang paa. Okay, so that comprises my discussion of the nursing care, musculoskeletal care modalities. Actually, this is just part one. I will discuss the next part of the discussion on our next meeting. So thank you for listening and God bless.